And we're going to be talking today, as you all already know, about preventing falls, improving some dynamic stability, moving better, right? Because at the end of the day, movement is life, right? We all want to be moving, we all want to be mobile, we all want to do the things that we love, and falling is a detriment to that across the board. So who we are, Rehab United, sounds like most of you are familiar with us. We follow the principles of applied functional science, which is a treatment strategy, a theory of human movement that looks at the body in all three planes of motion in ways that we can improve our functional mobility while mimicking the activities that we need to do throughout our daily life. Falls, as we all know, are very dangerous, and Shannon's got some statistics as to why.
So I don't want to scare anybody, just sharing facts. So why is falling so bad? Once someone falls, we tend to have a increased fear of falling. So that's pushing people not to participate in as much physical activity. We get a decline in physical ability and then increased risk of falling again. So approximately 1/3 of older adults fall every year. And falls are the leading cause of death from injury in people over the age of 65. 20 to 30% of people who fall have moderate to severe injuries, a lot of those being hip fractures. 20% of people with hip fractures see mortality in about a year due to complications following the injury.
So we need to consider risk factors when it comes to falling. As we all know, our bodies change with age. I'm not going to stand here and tell you what aging is like, right? All of you probably know a little bit better than I do about it. But we have, at the end of the day, truths about aging. While aging is a factor in our mobility, it is just a factor, right? So there's plenty of other things that we want to consider in terms of how to maintain our functionality, right? Hydration, nutrition, activity levels, these are all additional factors that are much more modifiable than aging. But as we age, it's impossible to deny that our sensory systems change. Vision decreases, our sensory input decreases. It makes it so that we have less awareness and control of our bodies in space, right? You combine this with decreased coordination from your central nervous system, the signal relays from your brains to your muscles and your muscles back to your brains take more time. This is going to decrease your reaction time. This is going to make it so that we can't recruit our muscles quite as quickly. Then you finally combine this with some musculoskeletal changes, decreased strength, decreased mobility, decreased muscular endurance. All of these things are going to combine to increase fatigue with movement and decrease our ability to control movement. The good news is that while some of these factors are obviously undeniable and inevitable as we age, some of these musculoskeletal sides are very adaptable. Our bodies are adaptive tools at the end of the day. If we're regularly doing strength and mobility work, we will gain strength and we'll gain mobility, or we will at least maintain the strength and mobility that we have, right? So if we work on our strength, our range of motion, and our muscular endurance, we can improve our abilities to move. There's also ways to help out around the house, which Shannon will touch on.
So like Troy said, we can't modify aging. That's out of our control, but we can modify our environment. So a lot of that includes removing clutter around our home, including rugs, power cords, like this one, and protruding tables that you might catch your foot on. We just want to be mindful of where they are and move them out of the way if we think they're going to be dangerous. A lot of times lighting is a big factor as well. So that would look like having night lights leading the pathway to the bathroom at night, just so you can see where you're going, watching your step. Also wearing properly fitting shoes. Big shoes, more likely to fall.
One other note that we neglected to put onto this slide, but just talking with Jason here earlier, totally rang true in my head. Mat in your shower is very helpful. Showers are obviously inherently slippery, they're more dangerous. Having something that will provide some traction on the shower floor is very helpful, as well as potentially installing some handles for stepping in and out of the shower, giving yourself a little bit wider base of support in an inherently more dangerous area.
So if we do use a walker or a cane to get around, we want to make sure that they are fit properly. That would look like making sure that the top of the walker or cane is in line with our wrist. That would make sure we're using it correctly when we're walking and not leaning too much on that side. We also want to make sure we practice using these devices at home before we go out in the community with them where there's unexpected people, things coming at us. If we are taking one or more medications, making sure we're aware of the side effects of those medications. A lot of that fatigue, lightheadedness, dizziness, those can always contribute to risk of falling.
Circling back to some of the musculoskeletal changes I was touching on earlier, balance has a strong correlation with muscle strength. The weaker we are, the less strength and control we have in our legs, in core, the higher risk we are of falling. So the central nervous system aspect comes into play too when we're looking at that reactionary balance. The need to react requires rapid muscle recruitment and rapid deceleration to slow myself down once I take that step unexpectedly. A couple things that we need to consider in terms of how questions to ask ourselves is how long can I stand on one foot? Every time we walk, we have to pick up one foot to put the other one down. If we can't balance on one foot, we're not going to be stable enough to lift up the other and set it down, which turns into shuffling. The more we shuffle, the more likely we are to catch our feet. The more likely you are to catch your feet, the more likely you are to fall. And this goes back to the circle of falls that Shannon mentioned earlier. Once we fall, we're at a higher risk of falling in the future. Another high frequency place for falls is in transfers, sit to stand specifically. The ability to stand up and sit down without the use of our hands, right? We want our legs to do the leg work. So the more reliant we are on our hands to press ourselves up out of chairs, to lower yourself down, the less your legs are doing, the less our legs will have strength to do those tasks in the future. A good test to run at home, and we always want to run these tests safely. If you have someone nearby to help you maintain balance, that's always helpful. But testing yourself on how quickly you can sit down and stand up 5 times. If your time is greater than 12 seconds, you are at an increased fall risk. So we always want to make sure that we're able to control our descent with our legs and avoid the plops.
So there's 2 kinds of balance, static balance and reactive balance. Static balance is the balance we traditionally think of where you're standing on one leg, trying to stay as still as possible. Reactive balance is more in response to things in our environment. So that would be walking on a busy walkway through the mall where people are bumping into you, catching your step, walking on uneven terrain, adjusting to changes, say if you're walking in the beach, or stepping over stuff that, like a curb or something in the street.
Or a power cord in the middle of a fall presentation.
So there's different kinds of static standing balances we can start with at home. Pictures here kind of give us examples. So feet, first we can start with feet shoulder width apart. That's kind of where a lot of us live. Wide base of support there between your 2 feet. In that position, you can start adding reaches to work on more reactive and dynamic balance. From there, if that gets easy, we can make it harder by putting our feet closer together, narrowing our base of support. So it'll be more difficult to keep your center of mass over that base of support. Again, adding reaches, lifts, presses to make that more challenging. From there, we can work into semi-tandem balance. So not quite tightrope walking, but almost there. And trying that out with either one foot forward and the other. Again, adding reaches, presses to make that harder. From there, going into full tandem, one foot fully in front of the other one. So it's like tightrope walking, and then slowly transitioning into one foot. Again, yes?
So then you lift up one foot on each of these exercises?
No, so sometimes this is challenging, just progressing the levels. Sometimes this on itself can be challenging, moving into one foot. Yeah, moving into one foot, and then we can add reaches too.
Yeah. Typically the way I like to progress people in the clinic is I'll start with the widest base of support, start with your feet wide, become stable and confident here. And I typically like to do these tasks maybe in the kitchen by the counter. So you can have your hands resting on the counter, pull them away, practice your balance if you feel unstable, counter's right there. Then as we're stable here and confident, then we can start adding some of our reaches, cross body, overhead, out to the side. Once you're fully confident and stable with those start to feel too easy. We reset and start the process back over again with your feet together in the more difficult stance. So then from here, you're going to practice feet together, standing, get yourself confident here. We can start adding some of those reaches in varying directions, allowing our body to move, controlling the movements throughout. And then again, practice your semi-tandem, stable with reaches, full tandem, stable with reaches, and then finally, one foot, stable with reaches.
I like the counter idea. I also like working in the corner of a room or a hallway because you can get two walls to kind of bounce off of in case counter might be too low or if we're falling in a different direction.
The other thing to remember too is that we do not need to skip steps and we do not need to jump to the end, right? While we do want to be able to be stable and balanced on one foot, safety is paramount. I say it in the clinic all the time, safety is first, second, and third, right? I'd rather make sure that we're getting good practice in these positions and challenging ourselves here instead of thinking, oh, I need to balance on one foot, so I'm going to jump straight there, and in that case, increasing our risk of falls in the moment. So a couple other dynamic stability exercises that we want to look at. As we mentioned, the sit to stand without hands. This is another one where we want to make sure that we're staying nice and stable. So I like to do this in front of a very sturdy chair or even at the bed potentially. That way, if you feel unstable at all, you fall backwards and then you're just sitting. But we want to do our best to do these transitions without the use of our hands. I had an instructor once upon a time when I was a student ask me what type of chairs out in the world have arms on them. The main places are wheelchairs and doctor's offices. Most chairs out and about in the world, as you are seeing as you sit right here, don't have a very convenient place for us to press ourselves out of the chair. So when we do our sit to stand, it's important to remember that we want to try to utilize our legs as much as possible. So while we're doing this, one place that people can get into trouble is they try to stand up. If I'm here and I try to stand straight up, I can't, right? My center of mass is too far behind my feet for me to stand up, right? And so what happens is we try to scoot way forward. Now my knees are out of whack and I push myself up with my hands. Instead, I want you to think of standing forward, right? If I'm here, I still want to scoot myself to the edge of the chair, but I then move forward. I line my body weight over my feet, simply press down to stand up, right? In this way, we can do this without our hands. One helpful way to practice at home is to have a partner, Shannon, come on over, have their hands out in front, and I can float. So if I need to, I can push down and use my partner's hands, and on the way down, I can give myself a little bit of support there as well. This is always going to be better than having your hands behind you, because then I'm going to catapult myself forward. So instead of stand up and sit down, I like to think of standing forward and sitting backwards. Because when I sit, I want to shift the body weight backwards so I can transition into my chair. Additionally, we want to practice climbing steps, right? While it would be great if we didn't have to hike up and down stairs every day, it's inevitable. There's going to be tall curbs. You may want to go on a hike with your family. The ability to elevate one leg, balance on one foot, and drive ourselves up the step is very, very valuable in this world. Great thing to focus on too when you're doing this work at home is on the descent, right? If I'm here, some of you may have heard me say this around the clinic, I want your muscles to take you down, not gravity. So if I'm here, this is a very tall step, so I would not advise starting on something this tall, but we climb up the step. If I just let gravity take me down, I'm gonna go there, right? That, if anything, is gonna put me at a higher risk of falling. Whereas instead, if I climb up the step here and focus on lowering my body, controlling the movement throughout, that will challenge the muscles in your legs to maintain strength, challenge the stability, and generally improve our control of movement. Finally, we also need to expect the unexpected, right? It would be nice if every single time you had to walk somewhere, you got to go in a straight line and nobody got in your way and you didn't have to step over anything. Not the way the world works, right? Someone's gonna throw a Mario Kart banana in front of you. There's gonna be wet floors. There's gonna be hazards that we need to navigate. So we need to be able that we need to be sure that we're able to move in all directions. Right, like I mentioned, applied functional science always looks at the body in all three planes of motion. We don't simply want to be able to walk forward. Sometimes we need to be able to move ourselves sideways and rotationally. So when you're practicing your walking, we want to learn how to step in every direction. One of the most common things I find people struggle with in terms of the reactionary balance is a rapid lateral weight shift. If I get bumped here and I can't cross over to recover, it turns into the 100-step fall, where I get bumped here and now I'm going down, right? So being able to cross our feet and maintain balance while we step, again, we want to practice these things safe and controlled environments. So we start simply by getting your foot out there and shifting the weight. Right, work on shifting the weight into that foot, get yourself comfortable here. Then we can start making it a little more dynamic, taking that step and return. And you can do this in all three planes. We can work on a little lunge sideways, shift the body weight over. Then we can make it a little more dynamic. Then we can go rotationally. You can work a little bit on some backwards. You've got to maybe go pick something up behind you, do the steps. And then finally, we can work on kind of the less common of these motions. Right, so if we're going to move front to back, our common motion would be straightforward, but we also want to consider a step backwards, shifting some of that weight behind. As I mentioned earlier, some of these crossover steps, being able to shift some weight into that foot, being able to step back and forth. And now a lot of these moves are a little more advanced, right? So like I was saying with the balance earlier, we want to work our way up to them. We don't want to skip steps. We want to make sure we're maintaining safety throughout. So being able to cross over, shift your weight into this foot and either take a step or even more difficultly, press yourself back up to your original starting space. These are all things that are worth practicing and very valuable resources to have in your world.
So we can take what Troy was saying a step further. No pun intended. We can start walking in every direction. So practicing walking backwards. I would not suggest walking backwards on a treadmill at first. Get really comfortable with that before you try that. Taking steps over things backwards in case there's an obstacle behind us. And then again, practicing that sideways walking. We sideways walk all the time when we're making the bed, shuffling between cars. Like Troy said, when someone bumps into us, we want to be able to catch ourselves with that crossover step as well. So just, again, taking it a step further and practicing prolonged steps in either direction. So if you do fall, we hope you don't. We want to make sure we have a way to get help. I know a lot of the smartwatches now have a tracker on it. They kind of let you know if you've fallen and ask if you need help. Just making sure there's a system in place to get help if you need help getting up. You always want to prioritize your own safety when you're in public. You know what you're capable of, and you know what you can do comfortably and safely. Put yourself first. Like Troy said, safety comes first, second, and third. So just be mindful of what you're doing. And then practicing a way to get back up. Number one risk of falling is fear of falling. So if we're not too afraid of the way back up, we should be okay.
Finally, just to discuss a couple of resources in the world to improve dynamic stability. As I mentioned, some of the things that Shannon and I touched on here are on the more advanced level, and we may not always be confident and comfortable doing them by ourselves at home or even with a partner, son, daughter, whatever it may be. Obviously, first and foremost, physical therapy is an incredible option. We'll circle back to that in a second because we also want to consider just simple walking programs. Like I said earlier, our body adapts to the demands we place on it. So if we consistently are progressing our walking distance, focusing on taking long strides, picking up our feet nice and high so that we can clear over obstacles, it's going to translate to an improved ability to walk in general. Exercise classes are great as well, whether group or individualized. Do be cognizant in group exercise classes, like Shannon was saying, of prioritizing your own safety. Just because the instructor says push, 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 doesn't necessarily mean it's obviously always the best idea for the individual. Circling back to physical therapy, obviously here as a PT clinic, we offer a wide range of options to help people reduce their risk of falls. The other thing that we always want to keep in mind too is the insurance and access. If you are on Medicare, Medicare will pay for maintenance work. They provide you with enough visits to the point where you can come to a PT clinic every other week, practice dynamic stability, work on reactionary balance, decrease your risk of falls. They do this because the cost on the system of preventing someone from falling versus once they fall and the recovery afterwards is significantly cheaper to the system. We do it because we want you to stay healthy, we want you to stay active, and we want you to stay mobile. So on the brochures that you have, they have the numbers of all of our PT clinics. You can give us a call. There's a QR code on there too. You can scan, and that will be able to provide a link to book an appointment. We love helping people at the end of the day. We do this job because we like to make people's lives better. And we really would love to have you and help you, even if it is just once every other week coming by, working on some balance, working on some strength, and getting everybody back to doing what they love. So that's actually a great question. In the state of California, there's a program called Direct Access. Direct Access provides citizens, people that live in the state of California, the ability to go straight to a physical therapy clinic, get an evaluation, and be treated without direct referral from a doctor. There are limitations on this treatment. That treatment can extend for 12 visits or 45 days, whichever one comes first. That's not necessarily a hard and fast stop after that timeline, but that is the timeline where we would need a doctor's referral. So in the meantime, you could schedule an evaluation, begin your treatments, start the process of getting the doctor's referral, and then that way, by the time the 45 days comes up, we don't miss a beat and we keep right on track. No, within reason, right? If your goal is to train for a marathon, they're not going to cover that too much. But in terms of dynamic stability, reducing fall risk, that absolutely falls under the umbrella.
You have an issue with your hip or something?
Yeah, totally falls in. Pain, trouble sleeping at night due to pain, you know, the inability to tie your shoes because your back hurts. These are all things that could be covered under Direct Access.
I was doctor's referrals are required myself. I'm surprised.
Yeah, it is something that California does very well in terms of providing low barrier to entry to physical therapy. We do treat patients with vertigo. I just had a woman in with vertigo earlier today. Vertigo is a very unique part of physical therapy, we'll say, in that there are a couple different potential causes, and based on the cause of the vertigo, we're going to treat it differently. But yeah, we manage that case frequently.